Good afternoon. 2 weeks ago, I stood before you and underscored that our healthcare system was facing a crisis driven by under-vaccination, that our healthcare system was in danger and critical steps were needed to protect it. To combat the surge in COVID-19 patients and hospitalizations threatening the system that we all rely on, I said that we needed to do three things. First, to maximize Alberta's healthcare capacity. Second, for as many people as possible to get vaccinated. And third, to reduce transmission of COVID-19 province-wide. Well, today I'm here to update you on this important work. But first, I want to announce new steps that Alberta's government is taking to protect staff, patients and families visiting hospitals, clinics and other facilities during this critical time. Recently, Albertans watched anti-vaccine protesters stand in front of our hospitals, hurling mistruths and misinformation about our healthcare system, our doctors, and our nurses. People were rightly shocked to see this totally inappropriate behavior from a vocal minority. Of course, all Canadians have the right to protest peacefully. But using our hospitals as a venue to attack vaccines and reasonable public health measures only adds more stress to our already overburdened frontline workers. These people protesting at hospitals have harassed healthcare workers who are fighting the COVID-19 crisis on the front lines, and they've disrupted Albertans there who are going to hospitals to seek treatment or support loved ones. Our hospitals are facing unprecedented pressure because of those who have chosen not to get vaccinated against COVID-19. Our healthcare workers have been doing amazing work throughout COVID. And we have seen similar protests in other provinces, like British Columbia, that actually impaired ambulance access to hospitals. That is why I'm announcing that Alberta's government is taking action to make sure that patients, families, and healthcare workers are able safely to access hospitals and other health facilities. Later this week, we'll put in place the Critical Infrastructure Defence Regulation. This will designate hospitals and other facilities that provide health services as essential infrastructure protected under the Critical Infrastructure Defence Act. This act, passed by the legislature last year, provides essential infrastructure, protects it rather from damage or interference by creating offences for trespassing, interfering with operations and construction, and causing damage. Justice Minister Kaycee Madu will provide more details in a moment, but we believe this is one more tool that law enforcement can use to protect access to healthcare for Albertans. We understand and respect that Albertans feel the need to protest. Again, there is no denying that they have that right. However, that cannot come at the expense of Albertans who need essential healthcare like cancer treatment or emergency services. It also must not impede the work of all the dedicated Albertans who provide that essential care to us and to our loved ones. I urge all Albertans, no matter what their beliefs or opinions on vaccination, for example, to support our hardworking healthcare professionals. The strain being placed on our healthcare system remains very serious. Our hospitals are under critical pressure, and we are doing all we can to increase capacity, particularly in intensive care. Over the last month, Alberta Health Services has taken difficult but necessary steps so that people who need that critical care can receive it. As of 11 a.m. today, we had 370 ICU beds in hospitals across the province with capacity at 86%. Every part of our province is impacted. The North Zone's ICU is currently at 100% capacity and Central Zone at 89%. South Zone is at 81%, Edmonton at 89%, and Calgary at 82% of capacity. The only reason that we have any beds available is because AHS has added 197 surge spaces, more than double the number that we maintain as a normal baseline of ICU beds in Alberta outside of this COVID time. It's also more than the number of available ICU beds that were available in waves 2 and 3 of COVID. Without those additional beds, our provincial capacity would be right now at 184% of beds. So I want to thank the Alberta Health Services team, all of their teams, who have worked around the clock to open these additional spaces and keep the healthcare system running. Because of the dedication and hard work of physicians, nurses, and other healthcare leaders, as well as staff, patients are still able to get the critical care that they need. While our hospitalizations and ICU admissions continue to rise, we saw some positive news in new COVID cases last week. We saw the total number of active cases decline before, unfortunately, rising a bit over the weekend, emphasizing again that we're far from out of the woods here. These are difficult times, and this fight is far from over. This means that we need every Albertan to do their part. That means following the rules, and it means getting vaccinated, most importantly, if you're not yet vaccinated. I've spent much of the last week on phone calls with business leaders, leaders of faith groups, and large employers across the major sectors of Alberta's economy, urging them to do everything they can to get their members and their employees vaccinated. And Albertans are rising to the challenge. Here's some good news. Throughout this pandemic, we have worked hard to vaccinate as many people as possible. More than 1,400 pharmacies, along with AHS clinics and doctors' offices, continue to administer COVID-19 vaccines across the province. To encourage Albertans to get their shots, we created rapid flow-through clinics when we were at the peak of vaccine demand. We developed the strongest incentive programs in Canada and created a new billing code for physicians to reach out to unvaccinated patients. We have had care workers help to deliver vaccines directly to people who are shut in at home. Care teams that have gone door to door in under-vaccinated areas to address questions and encourage vaccination. We provided for 3 hours of paid time off work for people who need to get vaccinated. We've held more than 700 pop-up clinics and outreach events which have brought vaccines directly to workplaces, hockey rinks, community centres, and places of worship. The Alberta Mobile Vaccine Bus has travelled to dozens of work sites and events across the province. We've spent millions of tax dollars to communicate the message of the safety and efficacy of the vaccines, responding to misinformation, including 2 brochures mailed to every single household in the province so far. Last week, we expanded third doses to give extra protection for those who can't develop strong, sustained immunity like most Albertans. The result of all of this has been an encouraging surge in vaccines. Throughout August, we were administering less than 9,000 doses a day. But since we launched the $100 incentive on September 3rd, we've averaged more than 16,000 doses of vaccine a day. More than 125,000 doses have been administered in the last week alone. And more than 180,000 Albertans have received their first vaccine shots since September the 3rd. So let me say thank you to every one of those Albertans who stepped up to protect themselves, their loved ones, and our hospitals. As of today, 83.2% of eligible Albertans have at least 1 dose, and 74% of them are vaccinated. Just to put that in context, just 3.5 weeks ago, we were at only 68% of first dose coverage, 78%, I should say, of first dose coverage, now at 83%, a 5-point increase in population. We've closed the gap with the rest of the country. A month ago, we were lagging the Canadian first dose vaccine coverage by about 8 points. We've now cut that to about a 3-point gap, and the momentum continues. We're not stopping here because we still have a long way to go. We will be launching a new advertising campaign in the coming weeks to educate vaccine-hesitant Albertans on the facts of COVID-19 vaccines. The campaign will use facts to debunk common myths of the vaccine and provide relevant information directly to Albertans. We want all Albertans to have access to this information. Everyone will receive a direct mail informational pamphlet. We'll also be running radio, digital, and social media, as well as billboard advertisements to spread the word. We're also developing specific advertisements to reach populations where we are seeing slower uptake in vaccination, including rural regions for Albertans in their 20s and 30s and other particular communities. As well, we'll be working with pharmacies and AHS to reach out to those who have gotten 1 dose but put off getting their second. Minister Copping will have more to say on that in just a moment. The bottom line is this, that we are still in the middle of a crisis. The 4th wave has challenged us more than any have challenged us before. But we are supporting Alberta Health Services in taking every possible step to continue to provide care to critically ill patients. 92% of COVID patients in our overstretched intensive care units are unvaccinated. So if you have not yet been vaccinated, you are putting yourself, your loved ones, and our entire healthcare system at risk. Please step up and do the right thing, because together we can and will get through this difficult time. Thank you, and with that, I'll now ask Minister Madu in Edmonton to provide more information on the actions being taken under Alberta's Critical Infrastructure Defence Act.
Thank you, Premier. Let me begin by expressing my profound gratitude to all of Alberta's healthcare workers, doctors, nurses, and other frontline staff, whose dedication, sacrifices, and tireless effort throughout this ongoing pandemic should be commended by everyone in this province. I share the Premier's dismay that a small number of people have chosen to express their opposition to vaccines and public health measures by demonstrating outside of hospitals and healthcare facilities. As distasteful as these demonstrations may be to many Albertans, the people who hold them are constitutionally entitled to them. However, when exercising these opinions crosses the line into interfering with the ability of Albertans to access healthcare and the ability of our healthcare professionals to provide it, often in situations where every second counts, we must take action. And so today, we are taking action. The provincial government passed the Critical Infrastructure Defence Act in 2020 to protect the essential infrastructure our people need to live their normal lives. Our government is making more explicit through the Critical Infrastructure Defence Act that the self-operation of our hospitals is, and indeed, critical. Through this regulation, we will be adding hospitals and healthcare facilities to the list of essential infrastructure. We are making sure that these vital facilities receive the same kind of protection. Those who hamper anyone's ability to access healthcare facilities must be stopped. This is another tool for law enforcement to ensure our hard-working healthcare workers can do the work we are so grateful for. Let me be as clear as I can be. This regulation is not about forbidding anyone's constitutional right to protest. This is about ensuring that people protesting do not impede access to health care or staff that make these facilities work. Albertans must have the ability to access health care when they need it, and healthcare professionals must have the ability to do their work free from interference. We will not tolerate anything else, and this legislation helps ensure that recklessness of a small minority does not endanger hard-working, law-abiding Albertans. And thank you, and may God continue to bless the people of our province. Now, I would like to invite my colleague, the Minister of Health, Jason Kenney, to provide his remarks.
Good afternoon. Thank you, Minister Madu, and thank you, Premier. I appreciate the opportunity to take part in this announcement declaring hospitals as essential infrastructure in Alberta. The past number of weeks have shown just how essential they really are, and they are under unprecedented pressure. That's why I have three immediate priorities as your new health minister. One, increase baseline ICU capacity and do this permanently. Two, reduce the pressure on hospitals by getting more Albertans vaccinated. And three, prepare the healthcare system for future waves of COVID. To ultimately achieve success, it is essential that we reduce the spread of COVID-19 in our province. Getting transmission back under control is critical to reducing the pressure on our hospitals and on our healthcare system. That's why we took the necessary and critical steps to bend the curve. Our healthcare system is still in critical danger, and any progress we make can be wiped out if Albertans don't continue to do the right thing. We know the measures in place can work if we keep embracing them, and every small step forward reminds us that the sacrifices are worth it. It's another reason today's announcement is so important. Hospitals and healthcare facilities are absolutely essential to Albertans and to the health of our province. And today's announcement means they will be protected, open, and accessible to all who need them. While people have the right to protest, every patient and family has a right to access vital health services in hospitals and in emergency wards, in dignity and without fear of being inappropriately questioned, delayed, or harassed. And every physician, nurse, and healthcare worker needs to be able to walk through those hospital doors without fear of being blocked or obstructive by a crowd of protesters. We are protecting our public health system, our public health facilities, and all those who head there to care for Albertans as part of their work. But when it comes to protecting our healthcare system and each other, there is one crucial thing that we as Albertans can do and have been doing. It's the most important tool that we have in the fight against COVID-19, and that's getting vaccinated. To the tens of thousands of Albertans who have rolled up their sleeves and gotten the jab over the last few weeks, I want to say thank you. The impacts of this action don't only benefit our overloaded healthcare system, they could save a life, yours or the life of someone you love. To Albertans who have not been vaccinated, for whatever reason, again, I want to urge you to please take action. Vaccines are our path out of this, but we need you to take the first step. There are appointments that are available all across the province. And if you are still hesitant, please speak with your doctor or a healthcare professional. We need to look out for each other and treat each other with kindness and empathy. And together, we can get through this wave just like we've done before. Finally, to our healthcare professionals, I want to end with the most important words I will say today. And it's simply this: thank you. I offer my direct and sincere thank you to the thousands of healthcare professionals who have given everything they absolutely have and so much more over the past 19 months. I hear you when you talk about how exhausted you are, how the toll these many, many months have affected your physical and mental health. And not just the effect on you personally, I know the burden also lands on your families and on your friends. I hear you when you talk about the tremendous strain on our healthcare system, how hard it is to go to work every day wondering when it will all end. And I know that I'm only a handful of days into the job and I'm not in the trenches with you, but I want you to know that I hear you and I will act. This is why one of my immediate priorities is to do whatever I can to help increase the baseline capacity in our ICUs. And another immediate priority is to help prepare the system for future waves and future public health crises. We should never find ourselves in the situation we are today again. And I will do whatever I can as health minister to make sure we do not end up in this situation again. So thank you to every health professional in Alberta. I hear you, and I will continue to listen as we move forward. Again, thank you, and I'd like to pass the torch over to Dr. Hinshaw.
Thank you, Minister, and good afternoon, everyone. Before turning to today's numbers, I'd like to clarify a comment I made during last Thursday's update that has been taken out of context in recent reports. When asked a question about managing outbreaks in schools, I mentioned that those staying home who were ill are counted as part of a respiratory outbreak, even if they have not yet been tested. This referred to school outbreak management only. To manage outbreaks effectively in school settings, all respiratory viruses are treated similarly by the current protocols in place, which helps reduce the chance of onward spread of any virus. However, that does not mean that we automatically count anyone staying home as a COVID case. Our high overall case counts reflect only cases that have been confirmed through testing or a very small number of probable cases, which are usually when results are pending. I want to clarify that point because the challenge we face is serious, and it is important that we do not dismiss or try to explain away the high case numbers that Alberta currently has. If you go back and watch my full response, it's clear I was only referring to school outbreaks, but these comments were then taken out of context. I would remind all Albertans to please consider the source of information when looking for updates on COVID-19, vaccines, or any other health measures. As I mentioned last week, we are working hard with education on an outbreak reporting framework for schools, and I hope to be able to update you on this very soon. Today, I would also like to announce a change we are making for child care facilities. Given the current high levels of transmission in the community, and to align our approach with schools, where all staff and teachers are now required to wear face masks, we are implementing a requirement for staff in child care facilities to wear face masks while at work. This is part of our layers of protection to protect those who are too young to be able to access vaccine. Similarly, I want to talk about another important protection for our communities, which is screening that happens at healthcare facilities. We've become aware of some incidents where designated support persons and visitors to those in hospital have not been honest about COVID-19 symptoms or recent exposures. They've attempted to enter our healthcare facilities, and this lack of transparency puts people at risk and creates further pressure on already overburdened hospitals. If you are the designated support person for a patient in a hospital, and if you are a close contact of a positive case, please do not enter a healthcare setting unless you are personally coming to receive care. And if you are, please disclose this recent exposure. It is critical to be honest when entering healthcare facilities and to not put others at risk by not disclosing symptoms or known recent exposure. There are other options for people to support loved ones in hospital if a visitor feels unwell. We must all work together to keep patients and health services safe for all Albertans. Turning to today's numbers, in the last 24 hours, we have identified 1,246 new cases and completed about 11,100 tests. Our positivity rate was about 11.5%. There are currently 1,100 people in hospital with COVID-19, including 263 in the ICU. I am sad to report that 18 more deaths have been reported to Alberta Health in the last 24 hours. My condolences go out to the loved ones of these individuals and to anyone who's lost a family member or friend in this difficult time. Of all those who have died from COVID-19 in the last 120 days, about 3 in 4 of them were not fully vaccinated against COVID. Almost 4 out of 5 of all those in hospital for COVID-19 and 91% of those in ICU in the last 120 days were also not fully vaccinated. These numbers speak for themselves. Vaccines are critically important. I've heard some concerns from healthcare workers and others who have received vaccine mandates from their employers. I would like to encourage every Albertan, regardless of where they work, to step up and receive the protection that vaccine offers. This protects not only themselves, but also those they come into contact with in their workplaces, in their homes, and when they socialize. We can see from the millions of Albertans who have safely received their doses that the risk from vaccines is low and the benefit is high. Delaying or refusing vaccination poses serious risks to our health. This is clear from the number of unvaccinated COVID patients in hospital and the ICU. Previous infection also does not guarantee lasting immunity. To get the best protection, please get vaccinated even if you have recovered from a COVID-19 infection. We need as many people as possible to choose vaccine protection for themselves and others, and right now we also need to minimize our in-person contacts with those outside our households. We have never needed each other more. Every person matters, and every choice matters. Thank you, and we're happy to take questions.
All right, folks, we'll now move to the media Q&A. We have a couple of people online, which we'll try to get to before jumping to Calgary and Edmonton for the in-person journalists. And with that, operator, can you please put through our first caller?
First is Licia Corbella with Post Media. Go ahead, please.
Thank you. Good afternoon. This question is for Dr. Hinshaw, but also possibly Minister Copping. I've learned through speaking to rural physicians that some acute care beds in rural communities such as Rimbey, for instance, have had to be cut back because of a shortage of nursing staff. Is this something that, is that because nursing staff is being shifted around the province and being sent, say, to Edmonton or Calgary or Red Deer? Or are nurses quitting en masse? Are they sick? What's going on with regard to this nursing shortage? Sort of wanted to know about that.
I'm sorry, unfortunately, I don't have details around nursing staff in Alberta Health Services, but would be happy to work with communications to get an answer, unless, Minister Copping, you have more information on this.
Well, I'll invite Minister Copping to supplement this if you'd like, but I can say, Alicia, that we have about 650 more nurses working in Alberta Health Services today than was the case a year ago, and defined as full-time equivalents. That's across the entire system, so that's undoubtedly, those are disproportionately FTE positions in the urban areas. The whole system, of course, is under strain. And in terms of that one particular hospital, I'm sure we can undertake to get back to you. But Jason, would you like to complement that?
Thank you, Premier. Yeah, I'll get back to you on the specifics in regards to Rimbey. I do know, in terms of working very closely with AHS, is that we can continue to bring more nurses into the system to be able to expand our capacity. Our capacity is at 370 now. We got line of sight on increasing that to 380, and then continuing to work to expand that even further. But again, it's critical that we expand our capacity, but at the same time get people vaccinated, and then follow the measures laid out by Dr. Hinshaw to be able to reduce the demand or the need for that capacity.
Okay, do you have a follow-up, Licia?
Yeah, I do, and this has come up a lot, and apparently Israel has what are called immunity passports. So they do look at a person previously having gotten COVID and recognizing that they are immune from having COVID for about 6 months afterwards. Is that something that the province might look at? I don't know if you can address that, so I guess the Premier.
I'll start with that and invite Dr. Hinshaw to add anything she'd like. First of all, yeah, we've looked very closely at the Israeli. I think they call it the Green Pass system, and you're right. They have incorporated into that immunity from prior infection as one of the criteria for the Green Pass, including, of course, their vaccination status. And I have asked if we could look at whether in the future we might be able to incorporate that into our own restriction exemption program, but right now it's not feasible. We needed to move forward urgently with our system when we decided to do so 2 weeks ago because of the extreme pressure on our healthcare system, and to incorporate into that records related to immunity through prior infection would be hugely complicated, technically challenging to validate when somebody was infected, when they recovered, the duration of time, recognizing that there is a decline in natural immunity, immunity through prior infection over time. So those are, and then how do you incorporate that into a government document? Those are all extremely difficult, complex questions, which I think is why none of the Canadian provinces that I'm aware of have gone in that direction. But it may be something for the future. Let me just add one point here, Alicia. I think, unfortunately, there's become a unnecessarily polarized debate over the question of immunity through prior infection. On the one hand, you have some people who seem to be minimizing or denying that there is immunity through prior infection, and on the other end of the spectrum, including some AHS employees who signed a letter this weekend, there seems to be an argument that prior infection obviates the need to get a vaccine. I think the most current research, and Dr. Hinshaw can comment on this, for example, the large study done by the Maccabee Health Management Organization in Israel and the Cleveland Clinic study validate that the most effective protection that people can have against COVID-19 is immunity through prior infection plus the vaccine. So it should not be seen as an either or, but for people who have been infected, it should be seen as a both and. And so we would encourage anybody who has recovered from a prior infection to also be vaccinated to get the strongest protection they can. Dr. Hinshaw?
Thanks, Premier. I would just add that we work closely with the National Advisory Committee on Immunization and our own Alberta Advisory Committee as well to look very closely at the evidence around what kind of immune response happens after infection, how that compares with vaccine. And to date, both our Alberta Advisory Committee and the National Advisory Committee on Immunization recommend vaccine after having recovered from infection as the most highly protective option that people have. We continue to look at emerging evidence, and as the Premier mentioned, we are looking closely at what other countries have done. But currently, I believe it's important, again, to remember, as the Premier mentioned, it's not either or, and that even if someone has recovered from infection, that adding a vaccine to that does provide enhanced and broadened protection, particularly against variants of concern.
Okay, thank you, Dr. Hinshaw. Operator, can you please put through our next caller?
Jeff Slack with 660 News. Go ahead, Jeff.
Hi, thanks for taking my question. This is for the Premier. You rejected calls for firebreaker restriction on Roy Green's show, saying it wouldn't be fair for the 80% of the population that is vaccinated. But with the healthcare system in its current state, it's already unfair to the unvaccinated because they aren't able to receive the care they need. So why are you willing to push our healthcare system to collapse, forcing us to initiate a triage protocol, but against implementing restrictions that could help relieve the system and potentially save lives?
Well, I'm not willing to push the system that far. I completely reject the premise of your question. We are monitoring the trends and the numbers very closely every day. If we need to take additional measures, we will, but they have to be effective. And one of the challenges that we are facing is that the pressure on our hospitals is coming overwhelmingly from the unvaccinated share of our population. That's now down to about 17% of adult Albertans. And we also find that segment of the population are the least likely to comply with public health measures or restrictions, including basic things like self-isolation or testing, or cooperating with contact tracers. So it is a complex situation because if we were to bring in widespread restrictions that that would most likely be complied with the people who are vaccinated, but we would likely see large-scale non-compliance among the unvaccinated population that wouldn't get us much further ahead. We will take additional measures if we deem them to be necessary, but that is one of the many complex challenges that we are facing right now. The bottom line is that we have put in place robust measures, a provincial-wide mask mandate, capacity limits, restrictions on various kinds of discretionary activities, most importantly, the restriction exemption program, which has helped substantially to increase vaccination coverage in the province. And we will continue closely to monitor the situation and take additional measures if necessary.
Thank you, Premier. Do you have a follow-up question, Jeff?
Yes, I do. Thank you. Well, hospitals are, currently there's 1,100 people in hospital, and the ICU is at, over 180% normal capacity. So, at what point is it for your government to say, okay, we do need to step in and take measures? You keep saying, well, we'll do that, we'll look into it, but it seems that now is the appropriate time to do that, is it not?
The answer is we already did. We took province-wide measures 3 weeks ago, an additional series of measures that were brought into effect 8 days ago, Monday of last week. We will closely monitor the impact of those measures, including the proof of vaccination or restriction exemption program, as that begins to emerge over the days to come.
Okay, thank you, Premier. Operator, can you please put through our next call?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi there. A question for the Premier. Earlier today, Angela Pitt said she didn't have any confidence in your leadership. We've had Leela here repeatedly say that you need to step down immediately. I'm just wondering, you don't seem to have completely tamped down this sort of caucus revolt from last week. So what's going on in your caucus? Do you think you have the support of your caucus? And is it sustainable for these members to still remain as part of your team when they're openly advocating for your removal?
Yes, I believe I have the support of our caucus. We met last week. I know some journalists had a lot of fun going into that, but in fact our caucus decided, I believe as a group, that we need to focus on the crisis that Alberta is facing and maintain stability and coherence as a government. That's exactly what we are doing. There's no secret, James, that over the past 18 months that some members of my party have been upset with the government having to act to respond to the threat of COVID. Some members who have been pretty consistently and publicly opposed to virtually any public health measures, to our efforts to promote vaccination. And we listen with respect to people across the political spectrum, including in my own party. But at the end of the day, the government has a responsibility to act and to lead, and that's exactly what we are doing, and that's exactly what we will continue to do.
And do you have a follow-up, James?
Yeah, there's also been some Facebook and social media posts from some of your MLAs in recent days that seem to be trying to shift the blame for what's happening in the hospital system onto AHS, questioning the salary of AHS's CEO. Can you tell me what's going on there? Is this a view that you share? And are you concerned at all that these comments are undermining public confidence in Alberta's health authority?
Well, I think you're referring to one MLA's Facebook posting. He has since issued an apology and a retraction for his remarks, which I think is appropriate. We are working very closely with Alberta Health Services to provide all of the necessary support in expanding health capacity. We have a cabinet subcommittee that meets almost daily with Dr. Yu and many of her senior management team, as well as people from Alberta Health, to ensure that we're taking coordinated action across government to do everything humanly possible to expand capacity and address the severe pressure on the healthcare system. We'll continue to do that. We need to work with the people who are in the midst of this right now, not just the frontline healthcare workers, but the executive leadership at Alberta Health Services with a team spirit, and do so collaboratively and respectfully.
Thank you, Premier. Operator, can you please put through our next call?
Next is Rick Bell with Calgary Sun. Go ahead, Rick.
Good afternoon, Premier. Just following up on an answer you gave a short while ago, for some clarity here, it appears at the moment on this day that you're staying the course with the plan that you have, and I understand that. It also appears that you are not convinced that these calls for lockdowns, that would be an effective way of addressing the situation, and I understand that. When you say we will take additional measures if necessary, are the kind of lockdowns being advocated on the table or off the table? And can you give us some indication of what kinds of additional measures and how bad would it have to be for those sorts of things to be triggered?
Well, first of all, Rick, we want to take a look at the data as it emerges over the next several days to ascertain what impact the recent round of measures has had. It's too early for us to make that assessment. Those measures only became generally, they only became effective 8 days ago, Monday of last week. So as you know, typically we need a longer period of time to be able to assess the impact of measures. Those are very widespread measures, most of them targeted on the discretionary activity of people who are not vaccinated because they are at a much higher level of risk for transmission and a radically higher level of risk for severe outcomes such as hospitalization. So these were very strong measures in addition to others taken 2 weeks prior. We'll monitor that very closely. If the advice we receive is that these measures have been insufficient to abate the case growth pressure and future hospitalization pressure, then we will take additional measures. I cannot predict what those would be. I know that Dr. Hinshaw and her team are always working on planning, contingency planning, forward planning, and looking at what other measures might be necessary. I would just say that I'll just repeat what I said earlier. Part of the challenge here is that the pressure in the hospitals is emerging from the unvaccinated 17%. They represent about 92% of ICU admissions. And I think by definition, we know that group of the population is the least likely to comply with any public health measures. So it is a paradox, and there's no easy solution to it.
And Rick, do you have a follow-up?
Yes, a brief one. So these lockdowns that people are calling for, just so I'm clear, I know you sort of addressed this on the weekend. Is that, I know you're going to be looking at many measures, but are those kind of lockdowns that were proposed, are they on and off the table? And when you look at the numbers and your charts, do you think, so it's kind of a two-part question, do you think that we are near the peak of cases, at the peak, or about to go over the other side of the mountain? So the first question is, are those kind of lockdowns that are being called for, is that off the table because you consider that they're not effective? And number two, how close are we, do you think, to the worst of how this is?
Well, let me just restate our basic commitment is to do what is absolutely necessary to prevent a worst-case scenario in our healthcare system. We have taken very strong measures. We are monitoring their impact. We will always take seriously any additional public health advice that we receive. So I'm not going to put things or take things off the table. We'll look at what would be the most effective measures should they be necessary. I would say, Rick, that we continue to run on the high side of the modeling that we released about 3 weeks ago. Having said that, there's a lot of different trends happening right now. We've seen a decline in the positivity rate and the daily case rate in the two large cities, Calgary and Edmonton, obviously linked to their much higher vaccination rates. But we've seen things recently going in the wrong direction in the 3 rural zones, particularly in those areas with the lowest vaccination levels. So that stands to reason. We also see that percentage-wise, the highest case growth happening now is amongst school-aged children who are not vaccinated in those rural areas with low levels of vaccine coverage in the general population. So it is a complex situation that we are looking at, and we'll continue to analyze that over the days to come. I don't know, Dr. Hinshaw, would you like to add anything to that?
I think that covered it. As you said, we're looking very closely at the data, looking at the options and considering what might need to be a next step if over the course of this week we don't see the impact from the measures that were implemented on the 20th that we need to see. I would just emphasize that what all of us can do is minimize the number of contacts we have with others outside our household, and those who are eligible to step up for first and second doses of vaccine. And those are the things that will make it the most likely that our current restrictions will be sufficient to bend the curve.
Okay, thank you, Dr. Hinshaw. Operator, can you please put through our next caller?
Next is Bill Fortier with CTV. Go ahead, Bill.
Hi, the question is for Premier Kenney and perhaps Dr. Hinshaw as well. We've learned that the Canadian Armed Forces is prepared and ready to send help in terms of healthcare staff. Newfoundland and Labrador also have a team of 20 to 30 healthcare staff ready to go. We're hearing from doctors on the front lines that help is needed right now, that it's needed yesterday, that, they're overworked and in a dire situation, but the province has said, no, we don't need that right now. There's no immediate requirement. Can you explain why that is? Why are we not welcoming that help right now?
So I'll take that question. First of all, as you know, a week ago today, we sent a letter to the Government of Canada to trigger the emergency support protocols to formalize some informal discussions that have been going on at the officials level between Alberta and the Government of Canada on any potential assistance. As I outlined last week, the Canadian Armed Forces has a very minimal health capacity. I think there is a fairly widespread misconception about the kind of depth they have in medical personnel. The fact is that, and that may be based on a kind of distant memory, the fact is 30 years ago, effectively the CAF shut down their hospitals and almost all of their medical work is done on contract by provincial health systems like ours or private contractors. So they only have a very small number of medical field personnel. When the Canadian Armed Forces assisted Central Ontario, Quebec, Nova Scotia earlier in Wave 1, it was primarily the deployment of reservists to supplement healthcare aid workers in nursing homes doing basic healthcare aid functions. And that is not a need that we have. Our acute need is in the area of registered nurses with ICU experience. We are in ongoing discussions with the Canadian Armed Forces about that, trying to get an exact understanding of what they could provide. The last I heard was perhaps 10 personnel, and that might add potentially capacity for 2 beds. We've asked that we want to also be aware, because it's a federal asset, about what other pressures they're looking at. The province of Saskatchewan, as you know, is in more or less an identical situation to Alberta in terms of cases and pressure on their healthcare system. And the Northwest Territories is also facing a very similar 4th wave. They have a very small healthcare system. So in addition, there are parts of British Columbia, the BC interior and northern British Columbia, that is under extreme stress in their healthcare system, where they're having to shift patients to the lower mainland. So I've asked Minister Copping to work with his counterparts there, as we work with Ottawa and the Canadian Armed Forces, to determine where are the highest priorities for those federal assets. But if we believe it's necessary to supplement our system here, we will certainly call upon the federal government to deploy whatever medical staff they can. But again, I think we need to be very realistic in our expectations that we would be talking about a small number of people. With respect to Newfoundland and Labrador, I was very happy to receive a call from Premier Fury beginning of September, I believe, just to express solidarity and say Newfoundland would, in principle, be willing to pitch in like they did for Ontario during the spring wave of this year, where they had sent, I think, 15 or 20 medical personnel to Ontario. And so we started discussions. We've gone back and forth, and those discussions are carrying on today. What I indicated to Premier Fury last week was that we were not reaching the upper limit of our health system, as we were concerned we might around September 23rd. And I said, based on our early warning system, that worst case scenario would not happen until the 3rd to 4th week of October. So, but if Newfoundland feels that they can free up some medical personnel to supplement our own frontline workers, we would be delighted to receive that support. In fact, I think they're most interested in sending some people up to the hospital in Fort McMurray, because, as Premier Fury said, Fort McMurray is Newfoundland's 2nd largest city. So I know those discussions are going on right now between AHS and the Newfoundland Health Service, so there may be news on that in the days to come.
And do you have a follow-up at all, Bill?
Quick follow-up. Right now, the highest active case rate is in the 5 to 11 age group. Now, we've heard from you before that children are less likely to get very sick, but of course, they can get very sick, and we know they can pass the virus along to mom, dad, and grandparents. So given the strain, the current strain the healthcare system is under, doesn't it make sense to tackle that very high rate of transmission that's happening in that 5 to 11 age group by canceling in-class schools and going back to online?
Well, I'll invite Dr. Hinshaw to add her comments in response, but I do note that in countries that were early in the vaccination program, like the UK and Israel, they have both recently experienced a case wave amongst unvaccinated younger school children. Neither of those countries canceled in-classroom instruction, and neither of them saw significant pressure on their hospital systems emanating from those younger children because of the very low risk of severe outcomes. And so we have always sought to prioritize in-classroom instruction, recognizing that there are real and lasting negative impacts on children and their life chances, on their mental health and well-being, to create the constant instability of opening and closing schools and not having the opportunity for socialization and in-classroom instruction. So the common practice in, I think, the majority of jurisdictions around the world, certainly British Columbia has done this, even when they faced case spikes in their schools, they were very determined to keep the schools open and did so safely. So that is obviously our first choice, but with that, I'll invite Dr. Hinshaw to add her comments.
Thanks. I would just add that that's exactly why about 10 days ago we did add some additional requirements to the regular operations of schools in terms of safety measures such as mandatory universal masking, in terms of required cohorting in elementary schools, and we are working with the Education Ministry to determine if anything additional is needed. But as was mentioned, education is a key determinant of health, and the access to in-school opportunities for learning and development is something that is a high priority, not just for those individuals attending school, but for all of us collectively. The number one thing that we can all do to protect schools is to reduce our in-person contacts outside our household, and for all those eligible to come forward and be vaccinated, as we are seeing that 5 to 11 case rate being driven primarily outside the two largest centres where vaccination rates are high.
Thank you, Dr. Hinshaw. We have time for about 3 more callers before we jump to Edmonton and finish on the floor. Operator, can you please put through our next call?
Next is Bill Kaufman with Post Media. Go ahead, Bill.
Yes, Premier Kenney, there's kind of been a joke going around that if you say certain measures won't be taken, then they certainly will actually be taken. And you're saying that you're monitoring the situation, and I'm guessing you're probably noticing they're pretty dire and pretty grave right now. So, I mean, it's pretty clear that additional, pretty concerted additional measures will be taken down the road. So, why not now, if that's pretty much inevitable?
Okay, Bill, I don't accept the premise of the question. As I've said in response to earlier questions, we have not yet had an opportunity to measure the impact of the most recent and widespread range of measures introduced in Monday of last week. Secondly, I've mentioned that the complexity of this, we're no longer dealing with 100% of the population that is imposing pressure on the healthcare system, but about 17% of the population. That is a group of the population that seems least likely to comply with public health measures. So this is, I'm just pointing out the complexity. We will act if necessary, but we do need to see the impact of the most recent round of measures that were taken. In terms of the joke to which you referred, you know, every government in the world has been trying to do its best to navigate through the ever-changing context of COVID-19 through trial and error. all 10 Canadian provincial governments, for example, expressed their opposition to proof of vaccination or so-called vaccine passport programs, and now all 10 have adopted those programs. In fact, the Government of Canada, Prime Minister Trudeau, this spring said he was opposed to measures like that before changing his view. So every government, Bill, has had to modify its approach based on the reality that we are facing, and that's exactly what we are prepared to do here in Alberta.
And Bill, did you have a follow-up to that?
I sure do. I'm just wondering if Premier Kenney, if you think there's any coincidence why the provinces of Alberta and Saskatchewan currently have such horrific trends in COVID numbers compared to the other provinces. I mean, is this a function of having conservative governments and the policies they follow?
Well, Bill, no, it's not, because I think 7 or 8 of the Canadian provinces have conservative governments in one way or another, from Nova Scotia, PEI, New Brunswick, all the way through to Alberta. What is unique about Alberta and Saskatchewan is that we've had the lowest vaccination uptake. And although we pulled ahead of Saskatchewan a bit, we're closing the gap with the national average. But it's pretty clear that the higher case growth in Alberta and Saskatchewan is a reflection of lower levels of vaccination, primarily in rural areas. It's not a problem in Calgary, and it's not a significant problem in Edmonton, but it is a significant problem in many rural areas where we have vaccination rates of below 60% of eligible population. And there's a whole lot of reasons for that. I think it's notwithstanding our very best efforts. We have had the strongest vaccine incentives. Many journalists mocked the government for the multi-million-dollar lottery prizes and for the $100 incentives, but those are evidence of our effort to go the extra mile. We were the first province to create a billing code for physicians proactively to call their unvaccinated patients and share accurate information with them. We passed a law allowing for 3 hours of time off work to get vaccinated. We, as I said, put up the $100 financial incentive. We've brought in the proof of vaccination or the restriction exemption program. We have worked very closely with local community organizations, had over 700 community clinics set up, over 1,400 pharmacies operating, spent millions of dollars on education and promotion. So I don't think we've left anything on the table in terms of making vaccines available and convenient, in providing accurate information and providing incentives. And I think it's all of those things together are now starting to have an impact. I would just say that we've gone, as I said, from 78 to 83% first dose coverage of the eligible population in the past 3.5 weeks. So that's important progress. We need to go further. I would certainly like to see Alberta at least at the national average of vaccination, and then I think you'll see our situation much more comparable to other provinces with higher vaccination rates.
Okay, thank you, Premier. Operator, can you please put through our second last caller?
Andrew Lawton with True North. Go ahead, Andrew.
Good evening, Premier. I wanted to turn to federal politics for a moment. Last week, Prime Minister Justin Trudeau's chief climate advisor, Sarah Goodman, said that the election showed the government has, quote, a mandate to do more faster on climate, unquote. Later this week, the government's public consultation on the just transition closes, and I'm just curious what message you would want to send about the just transition, or this idea that the government has a renewed mandate to ramp up its climate efforts.
Sorry, Andrew, the connection was a little, I heard the second question on just transition. What was the first one?
The first was on Prime Minister Justin Trudeau's chief climate advisor, Sarah Goodman, saying that the election showed the government has a mandate to do more faster. Those are her words.
Well, that's a peculiar kind of mandate where you actually lose votes and have the smallest percentage of popular vote for a government since 1867 in the history of the Federation. I think that perhaps should result in perhaps a bit of humility rather than hubris to say that it is a huge endorsement of the government's direction. I think what most Canadians are concerned about once we get past the COVID crisis, is economic recovery and stability. And a federal government attacking the largest sector of Canada's economy does not help us advance national prosperity, job creation, or economic stability. And market realities are now coming to bear with a growing scarcity of availability of energy. You see gas prices in Europe and in many parts of the world skyrocketing because there has been a lack of upstream investment, and there's been so much obstruction of pipelines and other export opportunities. So if Canadians are going into a long, cold winter paying sky-high gas prices in a country that has one of the largest gas reserves on Earth, I think they're going to be asking Ms. Goodman and Mr. Trudeau why the federal government has been impairing that industry. So I think it's our hope that the federal government will take a step back and realize that people need financial security, but also energy security, and Alberta will be a key partner in that.
And Andrew, do you have a follow-up at all?
I do. Last year, you endorsed Erin O'Toole's leadership bid, which we know was ultimately successful for the Conservative Party. After the election results, there have been some calls from within the federal Conservative Party for Erin O'Toole to step down, or certainly people wanting him to lose a leadership review, perhaps. Does he have your support to remain as federal Conservative leader still?
Yeah, I think that a party like the federal Conservatives should maintain stability. You know, I was part of Prime Minister Harper's Conservative Party when he lost the 2004 election. Many people were disappointed. He went on to become Prime Minister and form a very effective government for the next decade. So I think constantly changing leaders doesn't create a public confidence. And I think, you know, to be a leader, as Mr. O'Toole has tried to be in the context of a pandemic, is especially challenging to get your message out, to meet Canadians, to get to be known. So I'm sure that Erin is going to work with his team to identify things that could have been done better in this campaign and the lead up to it, to listen to grassroots party members. But I think the immediate instinct to remove a leader after disappointing election outcome just creates constant instability. So with that, I just wanted to actually come back to Bill Kaufman's question, where he was being very critical of Alberta and Saskatchewan. I do want to point out, Bill, that up until this point in the pandemic, Alberta has had a per capita fatality rate significantly lower than Canada's, significantly lower than Ontario and Quebec's, for example, and much, much lower than both the United States and Europe. And we have done that objectively with less damaging public health restrictions. So I think that speaks well of how Albertans have risen to the challenge. We are facing a crisis right now, as other jurisdictions around the world have. Quebec saw one of the highest per capita death rates in the world in the first wave. Ontario wasn't far behind them. Ontario, in their spring wave, was at pretty much exactly the point we are at in terms of intensive care pressure. Manitoba had to export ICU patients to Alberta and other provinces in their spring wave. So every jurisdiction has been, as I say, trying their best to face the reality with which they are confronted. And I would say that broadly, Alberta's policy has been quite similar to that of British Columbia. Governments of a different partisan stripe, but both of which have sought, for example, throughout, to keep the schools open for in-class instruction as much as possible, and both of whom have looked at damaging restrictions as a last and limited rather than a first and permanent resort.
Okay, thank you. And now we'll take our last call on the phone lines.
Shane Clothing with Everything GP. Go ahead, Shane.
Good afternoon. This question is for the Premier and I guess the Health Minister and Dr. Hinshaw, if you want to jump in. Just a quick question, just kind of on the situation here in Grand Prairie with our hospital. How exactly does it get better in the North Zone, I guess, especially here in Grand Prairie with the ICUs at 100% capacity?
Dr. Hinshaw.
I think it gets better the same way it gets better across the province, which is people stepping forward to receive the protection that vaccine offers. making sure that all of us are doing our best to limit contacts with those outside our household, staying home when sick. All of those basic measures are really what we all need to do to bring down cases, which limits the pressure on our acute care.
And do you have a follow-up for that at all, Shane?
Yeah, I did. I'm just curious, too, just with North Zone ICU capacities at 100% here across the province. I know across a lot of the province there's been talk about the triage protocols potentially being implemented. I know those haven't been officially announced, but there's been talk of them. Just with the North Zone hospitals being at 100% ICU capacity, has any of those triage decisions been made up here?
Well, I can jump in and say that triage protocols have not been triggered in Alberta, and we have been engaged in what AHS refers to as effectively moving patients from zones that are full to zones where there is capacity. So there have been a lot of patients moved from Grand Prairie, from the Queen Elizabeth Hospital and the Peace River Hospital to, for example, Edmonton and Calgary hospitals over the course of the past month. And it's always difficult to move patients, but it's been necessary. And Shane, I would say, on your first question, what's going to have to happen to kind of relieve the pressure up there? The answer is, Shane, people are going to have to step up and get vaccinated. The northwest part of Alberta has the lowest vaccination rates, the Peace Country in particular. And people have got to understand that if they get into a car accident or have a heart attack, they may not get the care they should because majority of the population in the Peace Country is unvaccinated. So anything that you can do as local media to convey that message, we've been turning to local leaders, local physicians and pharmacists, encouraging them to get that word out. But the health system in the Northwest is under extreme pressure because it has, I think, just about the lowest level of vaccination of any region in Canada. So it's urgently important that people in that part of Alberta take this seriously, protect themselves, protect their loved ones, and protect our healthcare system by getting vaccinated.
Okay, thank you, Premier. We're now going to jump over to take our last questions from the two folks in line in Edmonton. Just a reminder to anyone queued up to please state your name and the outlet you're with, as well as who you're directing your question to. And with that, I will pass along to the first journalist in line.
Hi, it's Janet French from the CBC. For the Premier, I just want to turn back to your remarks about speaking with Newfoundland Premier Anthony Furey and that you expect the peak of the fourth wave in Alberta in late October. Can you please describe for me what your projections tell you about how many people are going to be in ICU beds at that time, how many people you see in hospital and sick? Paint a picture for me.
Well, as you know, Alberta Health Services maintains an early warning system, which is basically short-term projections. They have a high, low, and medium scenario. They plan against the high scenario to ensure that we maximize capacity. And generally, in those scenarios, we've been tracking closer to the mid-range scenario. But certainly, we, if in a worst-case scenario, by the third or fourth week of October, we would be approaching the maximum capacity of ICU, which right now we define as 380 available ICU beds. If, however, the measures that were implemented last Monday across the province and the increased vaccination rates begin to abate the case pressure, then we would see ICU pressure begin to abate by the end of October. So those are things that we'll be watching very carefully.
And do you have a follow-up at all to that, Janet?
Yeah, so if we're a month away from that peak and people who work in the hospital say they're already overwhelmed, can you explain what steps that we're going to have to take to ensure that every sick and injured person in this province is going to have access to medical care if you track on that high scenario by October?
Well, that's what we're doing every single day in meetings with Alberta Health Services leadership and Alberta Health to review the workforce plan, capacity planning, opening more beds. We've also looked, of course, as you know, at contingency scenarios, including potentially shifting ICU patients out of province. We've been in ongoing discussions with other provinces that may have some flex capacity. We've also contacted hospitals south of the border in the United States and identified at least a couple who in an extreme scenario, might be able to accept patients. So we are doing everything we can to avoid that kind of scenario. Several provinces in Canada have had to resort to shifting patients out of province. I would point out right now, by the way, that we actually, in Alberta, we have a tradition of welcoming patients from other provinces and territories. We have about 9 out-of-province patients in our intensive care units right now. We will be indicating to other provinces that we, given the pressure, can't take additional patients from them. There may be an exception for the Northwest Territories because really they have nowhere else to go apart from the Alberta hospital system.
Okay, we now will move to our last question of the day. Go ahead.
Hi, this is Audrey from French CBC. My questions have been asked in English, so I'll just repeat in French more specifically. Monsieur le Premier ministre, vous avez dit que vous avez mis en place des mesures lundi dernier, mais il y a plusieurs associations médicales qui demandent d'en faire davantage pour freiner la courbe immédiatement, pour ne pas arriver au scénario catastrophique dont vous parlez dans 1 mois. Pourquoi est-ce que vous attendez encore avant de mettre davantage de mesures? Ce n'est pas exclusif l'un et l'autre.
Nous attendons à voir les résultats des mesures que nous avons prises la semaine dernière. Ça fait 8 jours depuis les mesures sérieuses ont été mises en place et il faut voir l'impact de ces mesures-là. On va suivre les chiffres prochainement à cet égard. Nous voyons dans les grandes villes d'Edmonton et Calgary que les nouveaux cas et le taux de positivité, ça bouge dans une bonne direction. Le problème, c'est vraiment régional dans certaines localités rurales avec un taux de vaccination très bas. Alors, il y a au moins un point de bonnes nouvelles maintenant, et ça, c'est l'augmentation importante de taux de vaccination. On a vu presque 200 000 Albertans qui ont pris leur première dose du vaccin dans les dernières 3 semaines. Et ça va aider dans les semaines à venir, j'espère, à diminuer la pression.
And Audrey, do you have a follow-up?
Yes, please. Monsieur le Premier ministre, il y a aussi Terre-Neuve et Labrador et l'armée canadienne qui disent être prêtes à offrir des ressources. Pourquoi est-ce que vous ne prenez pas leur aide immédiatement pour alléger la pression alors que les infirmières disent qu'elles sont carrément au bout du rouleau?
Comme vous savez, ça fait exactement 1 semaine. On a commencé le processus avec le gouvernement fédéral pour recevoir l'aide des agences fédérales potentielles. Cela étant dit, il faut comprendre que les forces canadiennes armées ont très peu de ressources médicaux. Ils n'ont pas vraiment un cadre de personnel médical large. Peut-être ils pourront fournir quelques personnes, mais si on a besoin, on va signaler au gouvernement fédéral l'importance de l'aide des forces armées. Quant à Terre-Neuve, j'ai communiqué avec le Premier ministre aujourd'hui. J'ai dit la semaine dernière que nous étions en mesure d'avoir une situation le plus sévère en septembre, mais donc en quelques semaines, c'est possible que nous aurons une situation le plus grave. Mais si le Terre-Neuve est dans une position partagée, quelques personnels actuellement, ça serait fantastique. Et il y a les pourparlers aujourd'hui entre les fonctionnaires de l'Alberta et les Terre-Neuve à cet égard.
All right, thanks, folks. That concludes today's media availability. Oh, I'm sorry. The microphone's right up here. I didn't see it. Could you actually speak to the microphone so the people streaming can hear you?
Sorry.
Mr. Premier, Bill McFarland from CTV. I know you've talked about what you're doing for hospitals and what the plan is, as best we can see it from here, to deal with ICU capacity and the strain on there. But what can you say to those healthcare workers, the ones that are essentially going in there and fighting this in the front lines day to day, the ones that have to face the tragedy firsthand, that have to hold the hands, that have to make the phone calls, that have to make those decisions where they are sometimes put in impossible situations? What can you say to them when we defer help, when we defer even just a little bit of help to get those people through? What can we say to those people?
Well, we can say
to tell them
how
things are gonna get better?
much we appreciate them, and we've been doing everything we can to bring more resources to address the COVID fourth wave crisis. We have more than doubled the number of available ICU beds. There's been a huge shift of resources. We've contacted friends across the country and even in the United States to see, in a worst case scenario, if they can be there to support us. And we are going to do everything we can to support our frontline healthcare workers as we face this crisis together.
Just a quick follow-up on that. Those are the actions that we're talking about. I'm talking about, what do you say to those people to help them get out of bed and go back into work again tomorrow, to know that something will get better for them?
Well, first of all, once again, I say a huge word of profound gratitude that I know all Albertans feel for our frontline healthcare workers as they're operating under extreme pressure. And just as healthcare workers in many parts of the world have gone through bone-crushing pressure over the course of the past 18 or 19 months, here, elsewhere in Canada and around the world, I hope we all have a newfound sense of gratitude for the work that they do. We have given AHS all of the support that it needs. There is not a lack of resources. We've increased the baseline health budget by $900 million. We have put forward $2.85 billion in COVID healthcare contingency funding. There are 650 more nurses as full-time equivalents operating in the system now. But we are experiencing what every jurisdiction in the world is, which is after 18 months of a hard grind, people who are really on the front lines, especially in intensive care units, nurses, for example, are increasingly burnt out. And we acknowledge that it's a challenge that's not unique to Alberta, and we'll be there to provide every bit of support that we can to them as we get through the remaining challenging weeks of this fourth wave.
All right. Thank you, Premier.
Thank you.